And then we move on to 4 to 6 months. So expressively, they start babbling using different sounds. So like p, b, m, d, t. So they might go papa, mama, da, 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 ta, ta, ta. Those type of babbling around this age. And they might start using vowel sounds. So usually that's the ah sound. So you might hear them going ah, over and over again. So that's all normal and that's all really good. And you might even hear some laughter and some chuckles at this time. And especially when they're excited or when they're upset, they might vocalize also. And when they're alone, and when you leave them alone to play, you will hear them babbling and making lots of sound in their crib or their cot. Or when they're playing with you, they might start making lots and lots of sounds. And then receptively, they might start moving their eyes in the direction of sounds. And some kids start doing this way earlier, but 4 to 6 months is usually around the time that they start doing it. So if you hold an object in front of them, like a toy, and you move it across the room, you might see them start following with their eyes. And they can start recognizing changes in your tone of voice. So if you're angry, they might react to it. Or if you're happy, they might also smile and laugh. And they start paying attention to music and to other sounds as well. And you'll see them acting reacting to those sounds or the music. And around 7 months to a year, they'll start babbling more sounds and more vowels, so it becomes more complex and a bit more speech-like. So they might go, rather than just ah, they might acquire more different vowels, so ba, 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 bi, 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 boo, 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 ta, 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 and start making different combinations, maybe pata, pata, different types of consonants and vowels together. And they might start using speech and non-crying sounds to get attention. So rather than crying for something, they might actually go ah 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 ba ba ba, mama, or something for you to get them. And they will start using gestures to communicate around this time. So you'll see a lot of high fives, a lot of waving, a lot of flying kisses, and they might start holding out their arms for you to get them. And they may also have their first words around this time. So around 9 months to a year, they might start having their first words. And these are usually words that they always hear. So familiar words like mommy, daddy, ball, cup, shoe, juice. But the words might not always sound clear because they haven't developed the speech part of it. So a word like ball might be ba. And they also tend to generalize when they have their first words. So for example, if they start saying mummy, so anyone who's a woman, they might call them mummy, and that's all pretty normal. Or a word like cat, they might refer to all animals as cats, not just that particular cat, and this is normal. Receptively, they start enjoying games like peekaboo and pat a cake, all the action games, games that you have to do actions and vocalize like singing and all that. They may turn to look at the direction of the sound. So if you call their name, they'll turn to you. They will listen when they're spoken to, so you'll see that they pay a bit more attention to you when you're talking. They start understanding words for common items like shoe, book, cup, or juice, those type of familiar first words. So if you say to them, take the cup, they might be able to crawl, or if they can walk by them, they can crawl to the item or walk to the item. So they can begin to respond to simple requests like come here or find mommy, things like that. Well, if they're not meeting these milestones, these are some of the things that you can do to help. But even if they were meeting the milestones, doing these things will further develop their language as well. So these are some of the things that you can do to help. First of all, it's really important to check their hearing. Because hearing is so important to speech and language development. Make sure that they don't have any hearing losses. Even a slight one will make a big difference. And if they're prone to ear infections, always keep those under control. Yeah? Okay, play with your baby. I can't stress enough on the power of play. So playing with your child is so important. So playing games such as peekaboo and see spider, counting your toes and your fingers, counting while going up and down the stairs, doing action songs and making lots of sounds, reading books together. These are all really important games, and they teach turn-taking skills that's needed for conversation, promotes eye contact, and teaches new vocabulary as well. And then you should also teach your baby to imitate actions. I'm sure most of you do this already, but keep doing them. Reinforce your baby's communication attempts. So imitate what they're doing and what they're saying. So if they are babbling, you can babble back at them. Doing these things sort of reinforces to them that they are doing the right things. And when they see that their communication has some effect on you, they'll be more likely to do it again and again. So if they're doing a certain action, like let's say they're waving back at them, so they think, oh, I should do this more often because I'm getting a reaction, okay? So talk while doing everyday things. See, all of us, we always think, oh, we need to take so much time out to play with our kids and to play all these games. But actually you can do a lot of this while doing all the everyday routine. So while during bath time, you can talk to them. So you can say, oh, washing your hair. Oh, I'm soaping you, putting soap, or blow bubbles in the bathtub. Or take some toys in the bathtub. You can do this as well. And while eating, you can say, oh, Haley, you're eating carrots. Yummy carrots, those type of things. So just keep talking a lot. Remember to use short but simple sentences when you're talking to your child at this stage. And if possible, try to minimize the number of words that you're using. So instead of saying, oh, hello there, you are eating a big carrot, you might want to say, oh, yummy carrots, orange carrot. Those type of things. So make it short because it's hard to imitate long speech. It's easier to imitate shorter sentences. And teach different sounds. So animal sounds, vehicle sounds. So when you see a cat, you don't just say, hey look, cat. You say, cat. Cat says, meow, those type of things. Because they are more likely to pick up on the sound rather than the actual words at this stage. Okay, and use child-directed speech. Child-directed speech include using high-pitched voice or sing-song tone when you're speaking to your child. The whole baby talk. Use a lot of that. And use clear pronunciation. It's really important for them to get the right modeling of sounds. And speak at a slower rate. We tend to speak quite fast. So with children, try to slow down your speech. And always be face-to-face with your children so they can see your expression, they can see your lip movement, because they are more likely to pick up on your words if you do that. Okay, now we move on to 1 to 3 years. So from 1 to 2 years, expressively, so some children get their first words after 1. So don't panic if they don't get their first words before 1. So some children get their first words within 1 to 1.5. But if by 18 months your child hasn't gotten any first meaningful words, then that's already considered a delay. Yeah. So within the 1 to 2 years age, you'll see that they will gain more and more single words each month. So within that age group, you want them to have at least 50 words of familiar people and objects, yeah? And at this stage also, you'll see them starting to combine 2 words together. So things like, oh, mommy shoe, baby juice, things like that. Daddy go, those 2 words together. And they start acquiring more and more consonant sounds, so their speech should start sounding a bit clearer at this stage. And they should start asking 1 to 2 word questions like what's that, what's this, where's mommy, those type of questions. And receptively, they should be able to point to a few body parts if you ask them. Like where's your eyes, they should be able to point to it. They should be able to follow some simple one-step command. And by one-step command, it means like one keyword. So things like take your shoe, take your cup, where's your teddy, those type of things, yeah? And they should be able to start pointing to pictures in books or pictures from a picture, pointing to words from a picture. So if you say, where's the bear in the picture, so they should be able to point to that.